Today, we're going to talk about OSHA record keeping. This is one of those subjects that can be really confusing. It's a compliance obligation that you have. You have to track these injuries and keep a 300 log and all the things that go along with that. And it's kind of hard to keep track what all of the different definitions are, and exactly what gets recorded, what doesn't. And so we do this webinar every year, and it's always well attended, and we always have a lot of questions. It's also a really voluminous subject. There's a ton to it. And so we're going to spend a lot of time doing this. I was optimistic and put 45 minutes on the webinar. I'll be straight up, folks. This is going to take a bit to go through. We're going to record the session and put it up on our YouTube channel or on Trey Lyons, so you can go back and check it out afterwards. We'll also share some materials as well to help you out. So let's dive right in. So we get to the subject. I watched last year's webinar, and I do a lot better in 1.5 speed. So I'm going to try to get as close as I can to 1.25 or 1.5 speed, so we can hit this. But please don't hesitate to ask questions. If you have those, type them in the chat box. Mike will monitor that and feed those to me, and we'll answer the ones that need to be answered right then. And if there's some that can wait, we'll have a Q&A at the end. First things first. OSHA regulates health and safety for employees throughout the United States. However, some states run their own plan. They will administer the OSHA regulations and their own regulations. There are 26 states that do that, and Utah is one of those. And so in Utah, we have the Utah Occupational Safety and Health, which is a division of the Labor Commission in the state of Utah. And I'm going to call them Utah OSHA or UOSH. And they're the ones that run this program. And so we really defer to them. But federal regulations come down to UOSH, and they administer them at the state, and they will regulate us on those. UOSH decides which standards that they adopt. Sometimes federal OSHA says thou shalt, and they have to adopt those. And sometimes they get in legal battles and all of that. But all of these regulations are in place in Utah, with a few exceptions, which are really important to this subject. And we'll talk about that in just a little bit. All right, let's keep going here. You have this is a really good opportunity for us to remind you about some posting requirements. Not 100% germane to the subject, but it's right close to it, because this is the same area we're going to be posting our 300A summaries here in just a couple of weeks. And in this area on your bulletin boards, you have some obligations under the Department of Labor, under OSHA, and also under UOSH to have some posters up. And you guys have seen these, I'm sure, in your work area. It's the law. That's the OSHA poster. And there are things about minimum wage and other posters that we have legal obligations to post. And so this is just the opportunity I take each year to remind you to look at those. There are lots of companies out there that will sell you a subscription, and they'll send out a really pretty printed laminated poster for you, and it's great. It just costs money. There's a much cheaper and easier, well, maybe not easier, there's a much cheaper option, and that is to go to Utah Labor Commission. There's a link on here. Mike's going to post it up in the comments as well if you want to click on that. They have a page, and they keep it up to date, where you can click on the poster, print it, and go out and stick it up on your bulletin board to maintain that compliance obligation. So this is your reminder there. I got a notice from one of these subscription companies recently trying to sell me these posters, and it gave a list of all of the new updates that had taken place in these posters. And there have been a significant number of those updates happen in the last year or two. So you ought to check those out and make sure that you're current on all those posters. So click on that link that Mike's putting up in the chat, and then post away. Okay, we're talking about injury records. OSHA tells us that we have to keep track of how many employees are injured on the job in our workplaces, and we need to track that in the OSHA 300 log. Well, record keeping is important. And Mike and I are really adherents to that. We're constantly looking at data. We are looking at reports so we can track trends and see things that are happening in your workplaces and where we may be able to help out. We try to stay on the leading edge, but we also got to look at those trailing indicators. What really happened out there, and is there something we can learn from that? So this is good beyond just the compliance obligation that we have with OSHA, is so we're grabbing this information, we're looking at it, and then we can use it in our safety committees. We can use it in our programs to determine how best do we manage our safety and how can we prevent those accidents from happening. Okay, so this is all governed under federal law. So the OSHA standard for this one is 29 CFR 1904. And if you Google that, 29 CFR 1904, look for the OSHA.gov website, the result that comes up, and you can go in and read the code. I always recommend going directly to the code. I try to help out and clarify things, but at the end of the day, if I start dealing with a standard, I'm always going to read the code. So that's a good thing. All right, there are some exceptions here, and some exemptions. We'll talk about those in just a minute. We have forms, Form 300, 301, and 300A. I sent those out to all of you who had signed up before about 9 o'clock this morning. You should have that in your email, so you've got those forms. If you want to open those up and have those maybe on a separate screen so you can follow along as we go through this information, that would be good. You also have a posting obligation, a requirement to post up your 300A summary on February 1st, and it needs to stay there where employees can see it until April 30th. You also need to keep these forms around for at least 5 years, 5 preceding years, so OSHA can take a look at those if they come out and do an inspection on your facility. We're going to define the difference between compensable and OSHA recordable. So, and then we're also going to define recordable versus reportable. And I apologize with the language here. It's not mine. This is what OSHA came up with. And so it can be a little confusing. Let's talk about compensable. When we're talking compensable, we're talking workers' compensation. Work comp doesn't have really much to do with what we're talking about today, except they may be the same injuries that we're seeing. So if we're thinking about if something is compensable under workers' compensation, that's a separate question. OSHA recordable simply means here's an injury that meets the definition that OSHA has set to be recorded on your 300 log. And then I have recordable versus reportable. Some claims are serious, or excuse me, cases. And that's another problem with the language there. I'm used to workers' compensation claims, and we're going to talk about cases today. A case is an injury that happens in the workplace. Some are serious enough that they need to be reported to federal OSHA or UOSH here in the state of Utah. And we're going to talk specifically about what those are in just a minute. But that's kind of the language that we're dealing. Compensable versus recordable, recordable versus reportable. And sorry about the language. It just is what it is. There are a few exemptions that exist. If you have fewer than 10 full-time equivalent employees, now that includes volunteers, so if you've got the volunteer fire department, they count. We look at their hours worked, and if we're over 10 times 20, 80 in our total hours, then we're in. There are certain workplaces that are exempt. We'll give you a few definitions of those as well. But here's my advice to you. I wouldn't split hairs on this. It's not a major deal to track an OSHA 300 log. And so if you've got we're at 9, and sometimes they work overtime. I wouldn't split hairs on this. Versus having OSHA show up. You have an accident or something like that. They show up to investigate, and they say, well, as a matter of fact, you are covered under this. Just do it. Track it. More than likely, if you're that small, you're probably not going to have anything or very few cases that will ever have to be reported there. Now, if you are exempt, there are some things that you still have to do, including reporting fatalities, those serious injuries, and also completing the Bureau of Labor Statistics survey. And if you get a letter, many of you have already received your letter that says, this year in 2026, we're going to be surveying you. And so you need to track these injuries that happen in your workplace. You're legally obligated to do that. And the OSHA 300 log gathers all of that information that you may need. So just go ahead and do it, and then we're covered there. All right. Who counts as an employee? Just a couple of things on it. Full and part-time employees and volunteers. State of Utah volunteers are tantamount to an employee, especially when it comes to people like volunteer firefighters, EMS people, those folks that are coming in and quote unquote volunteering their time. They may receive some stipend for the time that they spend. They're employees in the eyes of OSHA. Contractors do not apply. They don't count towards this. So if we hire a contractor to come in and do work for your organization, we don't have to keep track of their injuries. However, if I have temp employees, they may be required, we may be required to track their injuries. And the question that determines whether they would or not is really who has day-to-day guidance and supervision over them. If they come in, the only tie that this temp employee has to the temp agency is they get their check through the temp agency, but day in, day out, they show up, you tell them exactly what to do, and you're basically their supervisor. You need to track those, and those should go on your 300 log. Okay. All right. Here's that list of partially exempt industries, and just as for an example, the trust is under insurance, and also governmental agencies. We're exempt in a couple of different ways from this reporting, but for most of you, you're going to be in. There could be some organizations. I was thinking about associations of government. In most cases, they look like an office, and when you look at across these exempt organizations or industries, it would seem like, yeah, that's probably it. But then you take an AOG, and they have weatherization. They have people out there doing work like a contractor would do. They're doing insulation, windows, and all kinds of things like that. They're going to be in. So in most cases, you're just in. Okay. All right. We already talked about this. A workers' comp claim isn't always OSHA recordable. If I have somebody, I smack my hand with a hammer and I go to the doctor just to verify that it's not broken. I think it's broken. They do an X-ray and they say, no, it's not broken. It's gonna hurt. Put some ice on it, and take some ibuprofen. Well, that's not going to meet the definition of a recordable case, but it is going to be workers' compensation compensable because the doctor's got to get paid. And so we've got to make a determination on this. Who makes that determination? Well, as in all of OSHA standards, it comes back to the employer. The employer makes this call. We can help you, but it's down to the employer to make that call. An OSHA recordable injury isn't always a workers' comp claim. There may be a situation where somebody gets a bad laceration. They get a cut that would be worthy of sutures, but they really don't like going to the doctor and needles and all of that stuff, and they flat refuse to do that, and they go out and they get some super glue and glue that cut closed. Well, even though we didn't have medical treatment from a doctor, we got medical treatment. Surgical glue or super glue meets that definition. And we're going to go through what all of those things, how we make those determinations. But the point is that you've got to actively be engaged and make a determination. Is this a recordable case or not? All right. Next, and Mike, if there's anything, go ahead and jump in if there's a question I need to answer. OSHA Form 301. This is the first report of injury. In Utah, we call it the 122. It's the same form. You can take the information on that and make your own form. Put your logo on it and make it look really nice. All we've got to do is collect the appropriate information. That's the information that our adjusters are going to, or claims intake people are going to ask for when you call in a claim, or if you put it in online. That's the information they're going to ask for. So that information goes in. There's also a doctor's first report. That's a 123 form in the state of Utah, and they fill that out for any work-related injury that they treat. All right, so what's important about all of this? Reporting injuries is really important. And so our employees should report immediately when they are injured to their supervisors. Those supervisors should report all of those injuries to HR or whoever is responsible for claims or tracking the OSHA recordable injuries the same day, so we know about it. Now, there's a lot of reasons for this, but having a strong reporting policy is really good. The other reporting that is important that happens is that we get the information same day, if possible. Sometimes it may happen at the end of the day, and we don't quite get it, or I'm on my way home and they call and say, "Hey, so and so got injured." It may not come into the trust right away, but really within a day's time, we should get it. Why? Well, there's some reporting obligations that you have as well, and we'll talk about those in just a minute. All right. Here's the OSHA 300 log. That's the information that it gathers. Like I said, you can make the form pretty and make it usable for your organization. It can be online, where an employee could fill that out online as well. Okay, so let's talk about recordable versus reportable. Recordable injuries go on your 300 log. That means I have to record them on the 300. I write down, this is what happened and who it happened to. Reportable injuries must be called into Utah OSHA or UOSH. And we don't have much time to do that. So just a reminder, all reportable injuries are recordable, but not all recordable injuries are reportable. So you ask yourself, what is a reportable injury? Well, it's a serious injury. So here's what OSHA says: call UOSH at that number within 8 hours of the occurrence of fatalities, disabling, significant, and serious injuries and illnesses. Well, I'm sure you all out there have a different definition of what a serious injury or illness may look like. For all of us, probably we will look at this X-ray and we go, "Oh, yep, if my arm looks like that, it's serious." Well, UOSH gave us a little more information. This is just a screenshot right off their webpage that says, here's what you need to report within 8 hours of occurrence. We need to report any injury resulting in admittance to the hospital or impairment, permanent or temporary, where function of any part of the body is substantially reduced or made useless, and which would require treatment by a physician or other licensed healthcare professional. Examples include, but are not limited to, the following: amputation, fracture, deep laceration, severe burn, electrical burn, sight impairment, loss of consciousness, and concussion. Well, if I've got a broken bone, what does that fracture mean? In lots of discussions with OSHA folks over the years, if you break your pinky, they don't want to hear about it. But if you fracture your femur, a large bone, something like that, they want to hear about that. If there's an amputation, they want to hear about those things. If somebody is admitted to the hospital, now that doesn't mean you go to the emergency room and you're seen and get sutures and leave. It means that you are admitted to the hospital, and you're spending time there. So if you have a question about this, is something reportable or not, give us a call. And we are more than happy to walk you through that. It happens on a regular, not a regular basis, but occasionally we'll get that. I'm happy it's not on a regular basis, but sometimes on a weekend or late at night, we'll get a phone call, and you have our cell numbers. I'm not going to say those on here, but you know how to get in touch with us, just because we're going to post this up on YouTube, and I don't need any more crank calls. Anyway, you can give us a call and we will walk you through this. Mike is happy to take a call at 2 a.m. We also have, and I am as well, we also have federal reporting requirements, but because we're in the state of Utah, we don't care about those, because UOSHA's requirements are more restrictive than federal OSHA's, and so it's going to supersede that federal reporting requirement. Okay. So, OSHA requirements. Several years ago, OSHA released an addition to the record keeping standard that said employers have to submit injury data electronically. Their 300 data has to go in, and also specific information about each injury as it has changed. And everybody's panicking a little bit right now, going, "Hey, I haven't done that. What do I have to do?" Well, hold on. There's a big but. Government agencies are not regulated by federal OSHA. UOSH regulates government agencies in the state of Utah. So state government as well as our local government agencies are regulated under UOSH. But they don't care. They're already getting the information. Remember earlier we talked about when you submit your first report of injury and the doctor submits their first report of injury, the Labor Commission gets all of that. UOSH really doesn't want this extra level of reporting for our government agencies, and they've said we consider all local government agencies as being under the NAICS, North American Industrial Classification System, under 9200, which is government. That is not regulated under federal OSHA. So federal OSHA can't come in and regulate you as an organization, as a governmental entity, but UOSH can, and they say we've already got the information. So we don't need the extra level of work that is required with this and the complexity of it. So we just want to let you off the hook there. In most presentations on this, they're going to spend all their time on how do I do this electronic reporting. Well, we don't have to. It's nice little angle we have being governmental agencies. Okay. So as an employer, you have to decide if an injury is recordable or not. And we're going to go through each one of the steps here to determine whether it's a recordable injury or not. Okay, little flow chart that OSHA gives us. Did the employee experience an injury or an illness? If yes, well, is the injury or illness work related? It has to arise from work, right? In the course and scope of your work duties. And if it is the injury or illness a new case? If it isn't, well, they report it. It's 2026 now, and they were injured on this in 2024 or 2025. And they come back in and say, "Hey, my back's hurting again." I don't start a new case. I go back and I record any of those events on the correct year. Okay. I have to track the number of days off work. I track the number of modified duty days, and that goes on the log for the year in which the injury occurred. So that means I've got to keep Like I said, we're going to keep at least 5 years of these things, and I'm probably going to keep them forever. And I'm going to go in and update those cases as they change over time. Okay, so once we get to this point, does the injury or illness meet the general recording criteria or the application of or the application to specific causes? If it does, then we're going to record it. Well, and then you say, what is the general recording criteria? Well, let's take a look. What is an injury and an illness? Well, injuries seem pretty clear, right? Abnormal condition or disorder, cuts, fractures, sprains, or amputation, something like that. I cut my hand. That's pretty clear that that's an injury. An illness could be an acute or chronic illness from something. It could be from a chemical agent. I work cutting concrete my whole career and I'm breathing concrete dust, and I end up with silicosis that could be a fatal occupational illness. So sometimes the illnesses are maybe a little less clear than the injuries might be. Let's talk about what those illnesses might be. Some skin disorders are occupational. If I'm working with a chemical and it causes me to have hives or a rash or breakout in something, that skin disorder could be a recordable illness, a respiratory condition, like we said, poisoning, carbon monoxide poisoning in the workplace, hearing loss, other things. Some diseases can be recordable illnesses like tuberculosis. If you, for example, work in a health department and you're working with people who have tuberculosis and you unfortunately contract that disease from people in the course and scope of your work, well, that could be a recordable case under OSHA. All right. So remember, our recording criteria is it needs to be work related, it needs to be a new case, and it needs to meet the OSHA criteria. Well, let's keep going and look at that criteria. And I know this is where we muddy the waters a lot, but it's what we have to go through and why we're all here today. So, all right, recording criteria. A case is presumed work-related if and only if an event or exposure in the work environment is a discernible cause of the injury or illness or of significant aggravation to a pre-existing condition. So it's got to arise out of work. Now, there are some exceptions here. Just being at work doesn't necessarily mean it is an OSHA recordable case. So there are some things, if I'm not working, so let's say I'm at work and I take my lunch and I go run some errands and I slip and fall at a store or something like that while I'm out at lunch. That's not an OSHA recordable case. So travel within certain restrictions, and we'll talk about some specific details on that. Recreation or fitness. I take my break and let's say your company has some gym facilities and I'm running on the treadmill and I slip and fall off and twist my ankle or something like that. That would not be an OSHA recordable injury. Okay. Now there are some little grayer areas on this. For example, if we have firefighters that are full-time firefighters and they have required physical training that they're doing, there's a possibility that this would be an OSHA recordable injury there. Eating, drinking, preparing your own food. If you burn yourself as you're preparing your lunch, that is not an OSHA recordable case. Grooming, personal meds. If I take the wrong medication or take too many of my medication, or I'm putting my mascara on and I poke myself in the eye, none of those would be OSHA recordable cases. Motor vehicle accident in the parking lot or on my commute to and from work, none of those would be recordable cases. If I get a cold or a flu and I know it was that person I was working with that gave it to me, still not an OSHA recordable. Now that gets a little bit messy when we talk COVID. We'll talk about that on the next slide. Mental illnesses are not OSHA recordable cases in most situations. So what about COVID? If you get COVID, within 30 days of a workplace exposure, then that can be a recordable case. It's recordable if the employee, let's see, if but it's difficult because we have to figure out, did that exposure happen in the workplace? Now, when I got COVID, it certainly was a workplace exposure because there was direct exposure from someone who had it, and they said, "Oh, I've got it," and within a couple of days, I had it. That would be recordable. During the COVID pandemic, I know a lot of you HR folks out there were tracking these cases. We kind of backed off on that a little bit. You really have to be able to say, yep, this was an exposure that happened in the workplace, and I would record it there. Could it be reportable? And the answer is yes. If the case of COVID was transmitted in the workplace and that employee dies or is hospitalized from it, then that would be a reportable case as well. And interesting sidelight on this, adverse reactions to COVID vaccination are not recordable. Okay. Even if they are given in the workplace as part of your programs. Okay, recordable injuries that for sure are on there. Death, cases with days away from work. I'm injured bad enough that I can't work for a time. Job transfer, or restricted work activity, so one-armed work or seated or standing work only, transfer to a different department or a different job within the department. All of these would be recordable cases. Loss of consciousness. Now, just remember on this one, it's loss of consciousness from something that's work related. If I'm, sitting at my desk and let's say I stand up and I get lightheaded and I pass out. Well, just because I had that loss of consciousness doesn't necessarily precipitate being a recordable case. I would look at those each independently. However, if I stand up, get lightheaded, and fall over, and I smack my head on my desk as I'm falling, well, then that probably would be a recordable case. All right. And then the big one. If significant injuries or illnesses, we talked about those. And then the big one is medical treatment beyond first aid. Okay, this is where you've got to make some decisions, and it's a little challenging. What is medical treatment? Well, here's a definition: the management and care of a patient to combat disease or disorder. Well, that's nice. I don't know how much it helps us, but now we know what medical treatment is. Then what about first aid? Well, OSHA doesn't give us a definition of that, but they do give us examples. If it is first aid, I don't have to record it on my 300 log. So what is first aid? Non-prescription drugs at non-prescription dose is. So I've got a sore shoulder or wrist or whatever, and I take some ibuprofen for it. That's first aid. But if the doctor says, you've got a sore shoulder, you need to take prescription strength ibuprofen 800s, that is not first aid. That is a recordable case because a prescription, that is medical treatment. Okay, so non-prescription at prescription dose is not. Even if the employee doesn't fill the prescription, if the doctor writes the prescription, that's a recordable case. Okay. All right. Other things like drilling fingernails, and they don't actually use a drill bit to do this, but if you've ever smacked your fingernail and you get that little hematoma under there, they can take a hot wire and it melts through your fingernail to release the pressure there. It sounds terrible, but if you've ever had a fingernail drilled, the relief is incredible, right? The pain goes away almost instantly. Well, that is first aid. Cleaning, flushing, and soaking wounds is first aid. If I get a cut and it's dirty and I wash it, that's just first aid. Foreign body removal by simple means is first aid. I get a foreign object in my eye and I can use a tissue or a Q-tip to get that out of there. That's simple means, so that's just first aid. But if we have to surgically remove a foreign object, then that is medical treatment and would be a recordable case. I worked in an area where we company where we used really tiny drill bits. I mean, they were similar in size to a human hair, really, really small in the electronics industry. And if you inadvertently brushed into one of those, it was really strong this direction, but sideways it would break off. So it would poke into your skin and then break off. And they were so small that you couldn't see them to pull them out with tweezers. And a doctor would have to use an X-ray to surgically remove those drill bits. Well, that would be medical treatment. But if I get a splinter and I can take it out with some tweezers, that's first aid. Okay, hopefully that's clear. How about when I have a laceration? If I get staples or sutures, stitches, those are medical treatment. It's not first aid, and I've got to record that case. If I use normal Band-Aids, bandages, steri-strips, butterfly bandages, those are first aid. What about that super glue, though? I know a lot of people that swear by super glue. If they have a cut of any kind, they pinch it together and put some super glue on it. I don't recommend that because it may not be the most sterile way to do it, but it is pretty effective. If you use surgical glue or super glue on a wound, that is not first aid. That is medical treatment. And that's one of those areas where a non-workers' compensation claim can become an OSHA recordable case. Okay. All right. First aid is a splint or a brace first aid. Well, OSHA takes a pretty hard line on this one, and it's how hard the brace is. A rigid splint or brace is medical treatment. An elastic bandage or a soft brace is first aid. Temporary isolation. Let's say I hurt my finger. I think I broke my finger, and so we put a popsicle stick on it and we buddy tape a couple of fingers together. Go to the doctor to see if it's broken, and it isn't. That isolation, even though it was rigid, was just temporary isolation, and that's just first aid. Okay. All right. Vaccination. I step on a nail or I get a puncture wound and I go get a tetanus vaccination just to be careful. That is first aid. However, if I get a needle stick with a hypodermic needle or a lancet or something like that, and I go and get a hepatitis vaccination as a response to that injury, that's medical treatment. And I know that one doesn't make any sense why one would be and one isn't, but that's just the rules. And so now we know. Is hot or cold therapy first aid? Yes, it is. Massages are first aid, but physical therapy or chiropractic is not. Anything that's involving really manipulating a joint or doing something from a therapy standpoint is going to be medical treatment. All right. What about needle sticks? If I accidentally miss recapping, which you shouldn't do, and I poke my finger with that dirty needle, is that first aid to clean that up? And the answer is no. All needle sticks or punctures by sharps where someone is exposed to others' blood or potentially infectious material must be recorded as an injury on the 300 log. Okay. All right. Now we know what has to be recorded, and I know you're going to have some questions on that. And please just line them up in the chat box, and we'll answer all of those as we get to the Q&A. Let's figure it out. How do we record these? You've got the forms. We emailed those out to you today. We know that these recordable cases need to be recorded on the 300 log within 7 days, calendar days, from the time that you have knowledge that the injury occurred. I need to update these as changes happen. And back when I was dealing with this and managing OSHA 300 logs, I would do it on a weekly basis. I just had a reminder that every Friday or every Monday you'd go in and update update your 300 logs so we keep it current. We need to keep these current for up to 5 years or 4 or 5 years, and we got to keep those logs around. They can be electronic or they can be a hard copy. I always recommend having a hard copy, so if OSHA shows up, I've got hard copies there for them that I can allow them to take a look at. But you can manage it both ways. I said that I sent out the forms. I sent those out in both a PDF format and a Microsoft Excel format. I like Excel because I'm lazy. I can put it in there and it's going to automatically populate my 300A summary at the end of the year. OSHA doesn't have that on their website anymore. So the PDF is the only one that they make available. I don't know why they took it away, but I'm keeping it around and I'll keep distributing that out to you folks to use there. All right, so let's take a look at here's the 300 form, and we're going to zoom in and take a look at the information that you're going to record. So every case that is recordable needs to have a unique case number, and that's you come up with that number. You can use the workers' compensation claim number if you want, but I wouldn't recommend it. I would just make it a numeric number. I would start out with a year. I would always do, like, this year would be 26-001 for the first case of the year, and then 002 and down the line, just so it's a unique number for each case. We put the employee's name. Now, we're putting somebody's name on it. That means this is going to be a confidential record, and we need to protect that. We also have health information on there as well, and so the person keeping this information needs to be a person of trust, and they also need to maintain confidentiality with it and keep it in a form where it's not available for others to just grab and take a look at. All right, job title. What does the person do? And they give examples in here. A welder. Date of injury or onset of illness. So what month and day did it happen? Now, this is an annual log that we do, so we know it's in the year of 2026. So they just ask for a month and day. Where did the event occur? And be specific on this. The example they give us: loading dock north end. So give the location, and then describe the injury or illness, parts of body affected, and object, substance that directly injured or made the person ill. Okay, the example they give is second-degree burns on right forearm from acetylene torch. Okay, so in the information that I've got here, here's the person's name. They're a welder. On this day at this location, they were burned on the right forearm. Right? Is that what it was? Yeah. Right forearm by an acetylene torch. I got all the information I need to know really what happened there. I would always specify left or right, so we know exactly which body part it is when I have the choice. Okay, we move from that part to the right, and then we're going to classify each of these cases as one of these 4 different types: death or days away from work. Those are bad. And all we're going to do is put a X or a check in the box that's appropriate for this. The other 2 options are job transfer or restriction. That means the doc said they can only do one-handed work, and so we've got to transfer them to a different area, or they can do their job, but not everything. And so they're having restricted work. And then other recordable cases. That's kind of everything else. I got stitches, but I went back to work the same day without any restrictions. Okay. And then for each case, we're going to track the number of days the injured or ill worker was away from work or on job transfer or restrictions. And you may have both of a number in both of these boxes. What do I count? I count calendar days. Don't worry about shifts. Sometimes you've got a firefighter that's on a 48 hours on, and then quite a bit of time off. it doesn't matter. We're counting calendar days. So from the day that they're injured, I don't count the injury day. So let's say I'm injured at 3 o'clock in the afternoon. I need to go to the doctor and get stitches. I get my stitches, but by the time I'm done at the doc, it's the day's done. And so I go home. Well, I didn't lose any time that day, right? I was undergoing treatment. If the doctor took me off work or put me on modifications, we would start counting the next day. Okay. And then the next part, we're going to dive in just a little bit deeper, and we want to see exactly what class of injury was this. So basically just an injury or a skin disorder, respiratory condition, poisoning, hearing loss, and all other illnesses. So if it's an injury, that's pretty easy, right? I got a laceration, a fracture, something like that. I just check that box. The others, when I look at illnesses, then I've got to do a little bit more work there. Okay, that's a lot of stuff. Let's see, we covered that there. I had this great slide that told all of this stuff. So on days away from work, I start counting after day one, right? Not the day of the injury, and I'm counting calendar days, and I can stop if we get to 180 days, basically 6 months, or if the employee quits and I don't have them on the payroll anymore. Okay. For job transfer restrictions, once again, not the first day of the injury. And other recordable cases, what are they? No lost time or restrictions to the job duties, or if the job duties meet their restrictions. So it's not modifying their duty based on the restrictions that the doctor gave them or other healthcare practitioner. Okay. Ooh, said a lot of stuff. Mike, I don't know if we got a pile of stuff that we need to respond to yet, or are we good to keep going?
Nope, we're good to keep rolling.
Okay. Each year, we need to summarize the information from our 300 log. So you may have one case on there, or you may have 100 cases on your 300 log. You just keep adding more pages to your log if you go beyond the slots that we have there. That's why the Excel version is really nice, is I can just keep adding. I'm going to count up the totals from each line and then summarize those on the 300A summary and post it up. You have a compliance obligation on February 1st to post this in a public location within your workplace. And when I say public, I mean public to your staff. This would be a similar place like your bulletin board. Maybe it's by the time clock. It's where you have your labor law postings, those types of things. If there's something you want employees to see, and you're going to post it up. Now, remember, we're not posting names. We're not posting details about the injuries. We're posting a summary of what's happened there. No personal information on that. And it's got to be posted from February 1st till April 30th. And then you can pull it down, and I would just put it in a folder with your 300 log and have it for the next year. I'd print 2 of them up, put one in your 300 log, and post that one in case somebody throws it away. Also, your chief executive needs to certify. If you look here on the right side of this slide, there is at the bottom is the designated felon line. Now, this is where the chief executive of your organization says that this information is prepared, is true and accurate as to the best of our knowledge. There's also a few more things. Let's look a little closer there. You're going to put in there your establishment name. That's the name of your company and the location, and you'll give the address and then the industry description. What are you doing? And so you could just say government. And you could go into more detail if you wanted to, but you'd be okay to just put government. Under the NAICS code, put code number 9200. That's government. And that's kind of our get out of jail free card. We don't have to do the electronic reporting if we have that, and then have the boss sign it. Whoops, I forgot. We also need to do the annual average number of employees and the total hours worked. If you're not HR or payroll, you're going to want to look at that and find the hours worked and the average number of employees and put that on there. Why do we have to put that there? Well, OSHA's going to use that to calculate rates. And if your rate is inordinately high, you'll probably get a visit from OSHA more often. Okay. Um, um, it, Under these lines, we have to total number of deaths. We hope that's always zero. Days away from work. We hope that's always zero. Cases with a job transfer or restriction. We hope that's always zero, and the total number of other recordable cases, and we hope that's always zero as well. Total number of days away from work. Simply count those calendar days, and the restricted total days of restricted job restriction will count those. Now, some of you are saying, well, I haven't been doing this all year. How do I even come up with this information? Well, Mike and I can help you out with that. If you don't have the information, we can make you a report for any workers' compensation claims that have come in. Now, we're not going to have everything that happens, because if you haven't reported it as a claim, then we don't even know that it happened. Remember the super glue example, right? They didn't go to the doctor. You didn't report a claim to the trust. But we can get you a list, and we can show you your days away from work and your job restrictions. So talk with us about that. Be a little patient with us, because as soon as I say this, we'll probably get 40 requests, and it takes us a while to run those reports and email those out, but we will get those to you. And then we're gonna total the number of injuries, skin disorder, respiratory conditions, poisoning, hearing loss, and all other illnesses. And it's just a summary, so we can see how we did as an organization. A couple other things. Some of these are a little challenging. Hearing losses, call us. If there is an OSHA required medical removal, I don't think this is going to apply to anybody out there. But for example, if you had lead exposure and the person had lead poisoning, basically their blood lead level was over a certain action level, and the person had to be removed from their job because of that. There's certain ways to record those. Talk to us about that. Tuberculosis as well. Just give us a call, and we'll walk you through doing those. They're pretty uncommon, and so let's just walk through those. Privacy cases. There are some cases that were either required or we can be requested, and we need to respect that request by the employee. I don't want my case on the 300 log. We can have a separate log for privacy cases. What would those things be? Well, if I have an injury to private parts, that could be recorded on. It should be recorded on your privacy log. HIV, AIDS, hepatitis exposures, those as well, sexual assault, mental illness type things, needle sticks, where contaminated with another person's blood or materials. Those are things that could be on the privacy case. And if you've got a question, talk to us about that. What does that mean? It means it's on a separate log, and we certainly need to keep that confidential as well, so they're not visible. Okay, some must-dos on this. And you guys, I waited till the end on this one because this is what's going to make you mad. We need to have a separate 300 log for each establishment. What do I mean by that? Well, you may have different places of business. And I pick on North Salt Lake because I look across the street and the North Salt Lake City Hall is here. But this may be similar for your organization. North Salt Lake has City Hall, the police station is there, but they also have public works, and they have parks, and they are in separate locations or establishments. So we may have to produce more than one 300 log. We may have to produce a dozen if we have a dozen different establishments. So think about how you're now, if all of your employees come to one location every day, but they may it may work elsewhere. That's okay if this is their home base. But if their home base is the public workshop, that's their establishment. If their home base is somewhere else. Now, what do we do for home-based workers? Some of you out there have a significant number of people that work from home. They probably come into the office periodically for meetings or whatever, and that would be their home base. That would be their establishment. We don't do a 300 log for individuals' homes, but where their home base as an employee is. Okay. Each of these need to be recorded within 7 days of your knowledge of their occurrence. Once again, get everybody to report as soon as they can. We need to review, update all of those cases so our numbers are accurate. Certify that, get your chief executive certify it, and then post your 300A by February 1st. Keep these forms for 5 years. Have those completed forms. I need to go back and update those. So if I've got somebody that was injured in 2025 and they're off work and continue off work, I'm going to go back and update that until either they're not off work anymore or we hit 180 days. And then let's see, we don't update the 301 or the 300A after the fact. Once I have certified my 300A for the year, that's it. That's my report, and that goes in the file after we've done that. The 300 log itself is where we would update those. And then provide employee access. If an employee says, I was injured here and I want to see how my case appears on your 300 log, you have to provide access to that. Now, you can have a reasonable amount of time to be able to make sure it's updated, and also to be able to remove any information about others that are on there. They can see their case, but they can't see everybody else's. Okay. Once again, we've got injury data on there and names, so we have to be careful about who sees that. Okay. Couple of must-dos. Talk to your providers. If you've got a doctor that is writing prescriptions for ibuprofen 800s, maybe just say, hey, this causes us to have an OSHA recordable case. If they don't need prescriptions straight, can you just let them, if you just want them to have ibuprofen, we got that, right? We can cover that. Also talk to your providers about and let them know that you can accommodate restrictions. This helps on both OSHA record keeping, but more importantly, from your workers' compensation standpoint, it's going to control your premiums, and it'll also help the person get better quicker. So we're going to accommodate those restrictions. Provide first aid. Have supplies available, so we're not just sending everybody to the doctor when we could do something that could simply be done from a first aid standpoint. Be involved with your cases. Know what's going on. Track those to completion. And just the last here, keep your forms up to date. It's your job to decide as the employer, is it recordable or not? If you need to report a serious injury or illness, call us and we'll help you make that decision. Ask questions if you have them. Mike and I are available. That's our job, is to help you out on all of this stuff. Okay, that was a lot of stuff, and I apologize for going long. I imagine there will be some questions about this subject. If you got those, type them in the chat box now. If you want to, maybe it's a little more involved, you can give us a call or send us an email for that. Mike, what do we have?
I had a few questions. So folks, take a look at the chat. We've had some good conversation back and forth. But there was one question that I thought was important that I wanted to bring up to everybody here. It says, hypothetically, if an employee was injured but did not report the injury until after the close of business, the next day the employee who works remotely goes to well care, well check, or not well check. That's what you do for your kids.
Goes to the
goes
doctor.
to goes to the clinic. Yeah.
Yeah.
Is that recordable?
If they got medical treatment. So, so recordable, if they got medical treatment, yes. Would it be a lost time day? No. Day of injury, and I mean it could be a few weeks, right? I got my I injured my back, and I don't go to the doctor for 3 weeks. Well, at that point, they seek medical care. It becomes a recordable. We're going to put the injury date, but as far as are we losing days away from work? Well, does the doctor decide that? When the doctor says, "Yep, you need to take a week off, or you need to take 3 days off," that's where we start counting those days. I hope that answered that one.
Yeah. Go ahead, folks. If you got something, stick it in there in the chat. If there's a question, lots of information, lots of stuff. Jason did a fantastic job covering this. This is one we get a lot of questions on every year, because there's so many little nuances here. Jason did a fabulous job of presenting it and making it hopefully clear as mud for us all to understand. So if you got a question, type them in. But Jason, right now we don't have any others.
Wow.
Any others in the chat?
All right. I must have lulled them to sleep, because this is normally one that we have a lot of questions on. So, yeah, absolutely, folks. If you've got questions, give us a call, send us an email, and we will help you out.
Okay.
Nothing else?
Thanks, folks. Thanks all for being here, and go out and make sure you have a safe day.